But what about other things our body does, beyond just eating?
Oh, definitely. If we connect this to the bigger picture, it's clear that other physiological factors also profoundly alter results.
Right.
Take physical activity and stress, for example.
Okay.
Strenuous exercise can elevate enzymes like CK and AST, also potassium, lactate, cortisol, even white blood cell counts. I mean, think about how your body responds after a really tough workout.
Sure, you feel it.
And emotional stress can similarly increase hormones like cortisol and catecholamines. This isn't just about, feeling stressed before the needle stick. It's about actual physiological changes that the lab will pick up in your blood. Then there's something as simple as patient posture.
Posture, how does that matter?
Well, simply changing from lying down the supine position to sitting or standing up can significantly increase levels of hemoglobin, hematocrit, white blood cells, platelets, and even something called mean platelet volume. It's due to fluid shifts in the body.
No kidding.
So the key here is consistency. Ideally, the standard is sitting quietly for about 5 minutes before the venipuncture to let these factors stabilize. And here's a small but significant one. Even pumping your fist vigorously.
Oh, yeah. People do that to make the vein pop out.
Right, trying to help.
Yeah.
But that clenching can actually falsely elevate potassium and lactic acid levels in that sample.
Wow. So even that moment of trying to help the phlebotomist could actually throw off your own results. It just goes to show how intricate the body's chemistry is and how these small actions can have surprisingly big consequences for our health data.
It really does. And of course, medication and substance use are huge factors we need to consider. Common culprits like alcohol can elevate liver enzymes, AST and ALT, also creatine kinase, and affect lipid profiles.
Okay.
Coffee can interfere with glucose tolerance tests and certain hormone tests like medinephrine's. Smoking impacts hematology and coagulation tests and can even cause coronary artery spasms, which might affect cardiac marker tests.
And what about supplements? People take all sorts of things.
Exactly. Even seemingly benign herbal supplements can profoundly alter lab results, which really emphasizes the critical need for healthcare providers to ask about and document all patient medications and supplements on the test requisition form. Gives context. It's a holistic picture.
Okay, so with the patient properly prepared, fasted, rested, posture considered, meds listed, the next chapter in our samples journey begins, the actual collection. This is where we shift from what you do at home to what happens in the clinic or lab. And it's a world where one size fits all definitely doesn't apply.
Not at all.
So what does this all mean for you? Well, you now know that different tests require different types of samples and different collection methods.
That's absolutely right. Broadly, we're talking about a whole range of things: blood, urine, stool, mucus or sputum, post-cerebrospinal fluid, CSF, tissue samples, and other bodily fluids.
Okay.
And we often distinguish between invasive methods, those requiring needles or surgical entry, like drawing blood from veins or arteries, getting CSF via spinal tap, or taking biopsy.
Right. Things that go inside the body.
Exactly. Versus non-invasive methods which don't involve any penetration. Think urine collections, stool samples, swabs from the throat or skin, and saliva. Each type has its specific diagnostic power and purpose.
Let's zoom in on blood collection for a minute because that's probably the most common one, what most people experience. Venipuncture is the standard method, right?
Right.
Usually from a vein in your forearm.
That's the workhorse, yes.
And the general procedure, it seems quite precise from the guides. First, crucially, patient identification.
Always the first step.
Then applying a tourniquet, but for less than a minute, ideally.
Correct, to avoid stasis.
Cleansing the site thoroughly with alcohol, letting it dry, inserting the needle, filling the tubes in the right order, gently inverting them to mix with any additives, and finally applying pressure to stop the bleeding. Seems straightforward, but lots of little steps.
Many critical steps.
Then there's capillary sampling. That's for smaller amounts of blood, like finger sticks.
Yes, or earlobes. Or commonly heel sticks for infants, for things like glucose monitoring or newborn screening tests.
And here's a key detail I picked up from our sources. It's vital to wipe away the first drop of blood. Why is that?
Because that first drop can be contaminated with tissue fluids and skin cells, which can interfere with some tests. So you wipe it away and collect the subsequent freely flowing drop.
Ah, okay. And also avoid milking or squeezing the site too hard.
Definitely. That can rupture red blood cells, causing that hemolysis we discussed, and also dilute the sample with tissue fluid. Gentle pressure is key.
Got it. And then there's arterial blood sampling. That sounds more serious.
It's less common, but crucial for certain situations. It's primarily used for arterial blood gas analysis ABGs, which give us critical information about a patient's oxygenation, ventilation, and acid-base status. Think intensive care units, emergency rooms.
And where do they usually draw that from?
Typically the radial artery in the wrist.
Mm-hmm.
It's preferred because there's usually good collateral circulation via the ulnar artery, which is often checked first with something called the modified Allen's test.
Okay.
And unlike venous flood, arterial samples are extremely time-sensitive and usually need to be placed on ice immediately after collection and analyzed very quickly.
Right, because the gas levels can change rapidly. Moving beyond blood then, what are some of the other maybe unsung heroes of sample collection we should know about?
Well, urine is incredibly versatile. It's easy to collect, totally non-invasive, and so useful for everything from diagnosing urinary tract infections and assessing kidney function to drug screening.
And there are different ways to collect urine too, right?
Yes. There's a simple random sample. There's a first morning sample, which is usually the most concentrated and best for certain tests, like pregnancy tests or checking for protein. There are timed collections, like a 24-hour urine collection, often used to measure kidney function or hormone levels more accurately over time. And of course, the familiar clean catch midstream sample, which is crucial for urine cultures to avoid contamination from skin bacteria.
Okay. What about stool samples? Not the most glamorous, but important.
Extremely important. Stool samples are critical for diagnosing many gastrointestinal disorders, identifying infections like Salmonella, C. difficile, detecting occult blood that's hidden blood for colorectal cancer screening, and assessing conditions like malabsorption.
And CSF cerebrospinal fluid.
That one requires an invasive spinal tap or lumbar puncture to collect the fluid surrounding the brain and spinal cord. But it's absolutely critical for diagnosing serious central nervous system conditions like meningitis, encephalitis, brain hemorrhage, or multiple sclerosis.
And biopsies.
Tissue samples or biopsies are often considered the gold standard for definitive diagnosis in many conditions, especially cancer. Think bone marrow biopsies, breast biopsies, lung biopsies. But they are, by their nature, highly invasive procedures.
Okay. And lastly, swabs, like the ones we've all become familiar with recently.
Exactly. Swabs are generally non-invasive, used to collect surface material from areas like the throat, nose, wounds, or cervix. They're typically used for microbiology, looking for bacteria or viruses, or cytology, looking at cells.
It's really fascinating when you compare them, like when blood is clearly the most useful, say, for getting immediate drug levels, checking for acute conditions like a heart attack, or getting that systemic overview of the body, versus when stool is definitely preferred, like for those specific GI infections, or finding hidden bleeding, or figuring out malabsorption syndromes. Each sample type really does have its precise diagnostic sweet spot, doesn't it?
It absolutely does. Choosing the right sample for the right test is fundamental.
Okay, so beyond just collecting the right type of sample, our sources make it incredibly clear that the tubes themselves, the timing, how they're handled and transported, all of this is just incredibly crucial. This isn't just about putting liquid in a vial and sending it off.
Oh, absolutely not.
Yeah.
This is where things get highly technical and really precise. Blood collection tubes, for example, are designed with those distinct color-coded stoppers. And those colors aren't just for looks. They're a vital signal about the specific additives inside.
Additives? Like what?
Well, for instance, a red top tube might have a clot activator to help the blood clot quickly and completely, which is necessary for getting serum for many chemistry tests. A purple or lavender top contains an anticoagulant called EDTA.
Okay.
EDTA works by chelating or binding calcium, which prevents the blood from clotting. That makes it ideal for tests like a complete blood count or CBC, where we need to keep the blood cells intact and suspended.
Right, you need whole blood for that.
Exactly. A light blue top contains a different anticoagulant, sodium citrate, which is crucial specifically for coagulation tests, like checking how long it takes blood to clot. A green top usually has heparin, another type of anticoagulant, often used for certain plasma chemistry tests. And a gray top typically contains sodium fluoride and potassium oxalate. The fluoride stops glucose breakdown, or glycolysis, preserving the glucose levels, making it essential for accurate glucose testing, especially if there might be a delay in analysis.
Wow, so each color serves a very precise purpose, making sure the sample is perfectly ready for its specific analysis.
That's the idea. It standardizes the pretreatment of the sample.
That's such a neat system for organization. And the sources also highlight something called the order of draw. You mentioned it briefly. Why is that specific order so important, and what happens if someone messes it up?
The order of draw, yes, it's absolutely vital. It's a specific sequence in which different types of tubes must be filled during a single venipuncture, the main reason. to prevent contamination of samples with additives from preceding tubes.
Contamination between tubes. How does that happen?
Well, when you switch tubes, there can be microscopic carryover of the additive from the previous tube stopper or even slight reflux from the tube into the needle holder, which then gets into the next tube.
Ah, I see.
There's a common mnemonic to help remember the order. Clear blood really should get labeled gray, though the exact order can vary slightly depending on the specific tubes used by a facility. The principle is the same.
Okay, break down that mnemonic for us.
Sure. Clear often stands for sterile tubes, like blood cultures, which must always be drawn first to maintain sterility.
Makes sense.
Blood for blue, the light blue top tube for coagulation studies.
Yeah.
Sodium citrate.
Got it.
Really. For red or serum tubes, like red, gold, or tiger tops, with or without clot activator.
Okay.
Should sometimes represents SPS tubes, yellow top, if used separately from cultures. Get for green heparin tubes, labeled for lavender, or purple, the EDTA tubes for hematology. And finally, gray, for gray the oxalate fluoride tubes for glucose.
So following that specific sequence is crucial
Because if you draw out of order, you risk contaminating one tube with the additive from another, which can completely throw off the results. For instance, if EDTA from a lavender tube contaminates a tube meant for chemistry, it will bind the calcium and magnesium, causing falsely low results for those. And because EDTA salts often contain potassium, it can cause a falsely elevated potassium level.
Wow. Okay.
Citrate contamination from a blue tube into, say, a chemistry tube can affect enzyme levels. Heparin contamination can interfere with coagulation tests drawn after it, and sometimes even just the initial puncture can introduce tissue thromboplastin from the skin into the first tube, which can affect coagulation tests. That's why sometimes a discard tube, often a plain red top, is drawn first and discarded, just to close the line before drawing that critical blue top tube for coagulation.
It really is like a scientific domino effect, isn't it? One small mistake early on can topple the whole diagnostic process.